What's up, fellow health nuts? Today, we're tackling a question that's been on the minds of many: when is the absolute best time to take vitamin D? It's a nutrient that's crucial for healthy bones, muscles, and immune function. Still, with so many mixed opinions out there, it can be hard to figure out the best approach. But fear not. In this video, we're gonna break it down for you and give you the inside scoop on all things vitamin D. So, grab your sunglasses, soak up some sun, and let's get this party started. Vitamin D is a crucial nutrient that helps the body absorb calcium and strengthen bones. It also affects other bodily processes, including immune function and cell growth. While the body can produce vitamin D when exposed to sunlight, many people may not get enough vitamin D from their diet or sunlight exposure. Therefore, vitamin D supplements are often recommended for those who are deficient in this nutrient. However, the timing of vitamin D supplementation can also affect its absorption and effectiveness. The importance of vitamin D. Vitamin D is a fat-soluble vitamin that is naturally present in some foods and added to others. It is also produced in the skin when exposed to the sun's ultraviolet, UV, rays. Vitamin D is converted into an active hormone form in the liver and kidneys, which regulates calcium absorption and promotes bone health. It also plays a crucial role in the immune system, reducing inflammation and protecting against infections. Vitamin D deficiency is a common problem worldwide, particularly in older adults, people with limited sun exposure, and those with darker skin tones. A deficiency in vitamin D can lead to weakened bones, increased risk of fractures, and other health problems. Therefore, vitamin D supplementation is recommended for some individuals to maintain adequate levels. The best time to take vitamin D. The best time to consume vitamin D supplements is with a meal that contains some fat. Vitamin D is a fat-soluble vitamin requiring fat for absorption and effectiveness. Taking vitamin D supplements with a high-fat meal has increased absorption compared to taking it with a small meal or on an empty stomach. While there isn't a consensus on the best time of day to take vitamin D supplements, some experts suggest taking them in the morning since sunlight exposure can help regulate our circadian rhythm, which can affect vitamin D metabolism. However, it's important to note that individual factors such as diet, lifestyle, and medication use can also affect the absorption and effectiveness of vitamin D supplements. It's also important to note that getting vitamin D from sunlight is a natural and effective way to boost your levels. The best time to do so is between 10 a.m. and 3 p.m. when the sun is at its highest. However, the amount of sunlight exposure needed to achieve optimal vitamin D levels can vary based on factors such as skin color, age, and geographic location. In addition to supplements and sunlight exposure, vitamin D can also be obtained from certain foods such as fatty fish, egg yolks, and fortified foods like milk and cereal. However, getting enough vitamin D from diet alone can be difficult, especially for those with limited sun exposure or dietary restrictions. In these cases, supplements may be recommended to ensure adequate vitamin D intake. In conclusion, the best time to consume vitamin D supplements is with a meal containing fat to enhance absorption and effectiveness. While there isn't a consensus on the best time of day to take them, taking them in the morning may have some benefits. Factors affecting vitamin D absorption. Several factors can affect the absorption and effectiveness of vitamin D supplements, including body weight. Overweight and obese individuals may require higher doses of vitamin D supplements, as excess body fat can store vitamin D and reduce its bioavailability. Age. Older adults may have reduced skin thickness and less efficient vitamin D synthesis, requiring higher doses of vitamin D supplements. Skin color. Darker skin tones require more sun exposure to produce adequate vitamin D and may need higher doses of vitamin D supplements. Medications. Certain medications can interfere with vitamin D absorption, including antacids, cholesterol-lowering drugs, and seizure medications. If you're digging what you're seeing, smash that like button and hit subscribe for more. Recommended daily intake of vitamin D. The recommended daily vitamin D intake varies depending on age, gender, and other factors. According to the National Institutes of Health, NIH, the recommended daily vitamin D intake for adults aged 19 to 70 years is 600 international units, IU, per day. Adults over 70 may require up to 800 IU per day. However, individuals with vitamin D deficiency may require higher doses. Vitamin D toxicity. Vitamin D toxicity, also known as hypervitaminosis D, occurs when there is an excessive vitamin D intake, leading to high levels of calcium in the blood. This can cause a variety of symptoms, ranging from mild to severe. Symptoms of vitamin D toxicity may include nausea, vomiting, poor appetite, constipation, weakness, and weight loss. In more severe cases, it can cause kidney damage and even death. However, it's important to note that vitamin D toxicity is rare and typically occurs with prolonged and excessive supplementation, not with moderate sun exposure or dietary intake. The safe upper limit of vitamin D intake varies depending on age and health status. According to the National Institutes of Health, the tolerable upper intake level, UL, of vitamin D for adults is 4,000 IU per day. However, some studies suggest that higher levels of intake may be safe for short periods, such as for treating vitamin D deficiency. In summary, vitamin D toxicity is rare. It typically occurs with prolonged and excessive supplementation, not with moderate sun exposure or dietary intake. It's important to follow the recommended daily intake guidelines and talk to your healthcare provider before taking any supplements to avoid putting yourself at risk for toxicity. Well, folks, that's a wrap on our vitamin D video. Hopefully, you guys found this helpful, and it cleared up some confusion about when to take your supplements. Remember, getting enough vitamin D is crucial for keeping your bones, muscles, and immune system healthy, so make sure you get it in whatever way works best for you. Whether you're a morning person or a night owl, just remember to take your supplements with a fatty meal to help with absorption. And hey, don't forget to hit that like and subscribe button for more awesome health tips and tricks.